Looking for comprehensive information on etonogestrel medication? You're in the right place. In this guide, we'll delve deep into the benefits, side effects, and usage of etonogestrel. Etonogestrel is a progestin hormone used in various contraceptive products, such as contraceptive implants and birth control patches. It works by preventing ovulation and thickening the cervical mucus, making it harder for sperm to reach the uterus. What is etonogestrel medication? Etonogestrel is a synthetic form of the hormone progesterone. It is used in contraceptive products to prevent pregnancy. This medication is available in the form of implants and patches. Etonogestrel implants are small, flexible rods that are inserted beneath the skin of the upper arm. They release a steady amount of the hormone into the bloodstream over a period of 3 years. On the other hand, etonogestrel patches are applied directly to the skin and deliver a continuous dose of the hormone for a week before being replaced. Benefits of etonogestrel medication. Etonogestrel medication offers several benefits for women seeking effective contraception. One of the primary advantages is its high success rate. Studies have shown that etonogestrel has a contraceptive effectiveness of over 99%, making it one of the most reliable forms of birth control available. This means that only 1 in 100 women using etonogestrel as directed will become pregnant within a year of use. In addition to its contraceptive properties, etonogestrel has been found to have other positive effects on women's health. Many users report a reduction in menstrual pain and cramps, making it an attractive option for those who experience discomfort during their periods. This can greatly improve the quality of life for individuals who suffer from severe menstrual symptoms. Furthermore, etonogestrel can help regulate menstrual cycles, making them more predictable and manageable. Common side effects of etonogestrel medication. While etonogestrel medication is generally safe and well tolerated, it does carry the risk of certain side effects. It's important to be aware of these potential effects and discuss them with your healthcare provider before starting etonogestrel. One of the most common side effects of etonogestrel is irregular menstrual bleeding. Some women may experience lighter or heavier periods, while others may have spotting between periods. These changes in bleeding patterns usually resolve after a few months of use, but if they persist or become severe, it's important to consult with a healthcare professional. Weight gain is another potential side effect of etonogestrel medication. Some individuals may notice a slight increase in weight while using this contraceptive method. However, it's important to note that weight gain can also be influenced by other factors such as diet, lifestyle, and genetics. If you are concerned about weight changes while using etonogestrel, it's best to discuss it with your healthcare provider to determine the cause and explore possible solutions. Mood swings and changes in mood are also reported by some etonogestrel users. While not everyone experiences these side effects, it's important to be aware of the possibility. If you notice any significant changes in your mood, such as increased irritability or feelings of sadness, it's recommended to reach out to your healthcare provider for guidance and support. Headaches can occur as a side effect of etonogestrel medication. These headaches are usually mild and temporary, but if they persist or become severe, it's important to consult with your healthcare provider. They can help determine if the headaches are related to etonogestrel or if there may be another underlying cause. Usage guide for etonogestrel medication. Using etonogestrel medication correctly is crucial to ensure its effectiveness and minimize the risk of side effects. Your healthcare provider will provide you with detailed instructions on how to use etonogestrel implants or patches. It's important to follow these instructions carefully and ask any questions you may have. For etonogestrel implants, a healthcare professional will insert the implant under the skin of your upper arm. The procedure is relatively quick and can be done in a clinic or doctor's office. The implant should remain in place for up to 3 years, providing continuous contraception during that time. It's important to regularly check the implant's placement and contact your healthcare provider if you notice any issues or have concerns. Etonogestrel patches are applied directly to the skin. Before applying a new patch, make sure to clean and dry the area thoroughly. Press the patch firmly onto the skin and hold it in place for a few seconds to ensure proper adhesion. Replace the patch once a week, on the same day each week, to maintain a consistent hormone level. It's important to avoid applying the patch to irritated or broken skin and to rotate the application site to prevent skin irritation. How etonogestrel medication works. Etonogestrel medication works by primarily preventing ovulation, the release of an egg from the ovaries. It does this by providing a steady amount of progestin hormone, which inhibits the hormone signals necessary for ovulation to occur. Without ovulation, there is no egg available for fertilization by sperm, reducing the chances of pregnancy. In addition to preventing ovulation, etonogestrel medication also thickens the cervical mucus, making it more difficult for sperm to reach the uterus. The thickened mucus acts as a barrier, preventing sperm from swimming through the cervix and reaching the fallopian tubes where fertilization typically occurs. This dual mechanism of action provides a highly effective form of contraception. Etonogestrel medication and birth control. Etonogestrel medication is a popular choice for individuals seeking reliable birth control. Its high success rate and long-lasting protection make it a convenient option for those looking for effective contraception. The ability to prevent pregnancy for up to 3 years with a single implant or on a weekly basis with patches offers flexibility and peace of mind. It's important to note that etonogestrel does not protect against sexually transmitted infections, STIs. If you are at risk of STIs, it's recommended to use barrier methods, such as condoms, in addition to etonogestrel medication to reduce the risk of infection. Etonogestrel medication and menstrual irregularities. For individuals who experience irregular or heavy menstrual bleeding, etonogestrel medication can provide relief and help regulate menstrual cycles. The hormone in etonogestrel can help stabilize the lining of the uterus, reducing the likelihood of heavy or prolonged bleeding. This can result in lighter, more predictable periods, making it easier to plan and manage daily activities. If you have concerns about your menstrual cycle or experience significant changes in bleeding patterns while using etonogestrel, it's important to consult with your healthcare provider. They can help determine if the medication is the cause or if there may be other underlying factors contributing to the irregularities. Etonogestrel medication and acne treatment. In addition to its contraceptive benefits, etonogestrel medication has been found to have a positive effect on acne. Many individuals using etonogestrel have reported improvements in their skin, with a reduction in acne breakouts and overall clearer complexion. The hormone in etonogestrel can help regulate sebum production, which is often a contributing factor to acne development. If you are struggling with acne and considering using etonogestrel medication, it's important to discuss this with your healthcare provider. They can help determine if etonogestrel is a suitable option for you and provide guidance on managing acne alongside the medication. Etonogestrel medication and polycystic ovary syndrome, PCOS. Polycystic ovary syndrome, PCOS, is a hormonal disorder that can cause irregular periods, excessive hair growth, and fertility issues. Etonogestrel medication can be beneficial for individuals with PCOS by helping regulate menstrual cycles and reducing androgen levels. Androgens are male hormones that can be elevated in individuals with PCOS, contributing to the symptoms associated with the condition. If you have been diagnosed with PCOS and are considering etonogestrel medication, it's important to discuss this with your healthcare provider. They can evaluate your specific situation and determine if etonogestrel is a suitable treatment option for you. Conclusion. Understanding etonogestrel medication is essential for making informed decisions about contraception. This comprehensive guide has provided insight into the benefits, side effects, and usage of etonogestrel. From its high contraceptive effectiveness to its potential impact on menstrual irregularities and acne, etonogestrel offers a range of advantages for individuals seeking reliable birth control. As with any medication, it's important to consult with a healthcare provider before starting etonogestrel to ensure it is the right choice for you. They can provide personalized advice, address any concerns or questions you may have, and help you make an informed decision about your contraceptive options. Remember, the information provided in this guide is not a substitute for professional medical advice. If you have specific questions or concerns about etonogestrel medication, reach out to your healthcare provider for guidance tailored to your individual needs and circumstances. Thanks for watching.